be watching you walk so I can get a better idea of how you naturally want to move. So I'm going to get you to walk towards me and away from me twice, and then you're going to do the same thing, but I'll watch you from the side, and it's just for me to be able to tell if you favor one side over the other, if things rotate, if shoulders are off, if you tend to tilt your neck a certain way, things like that. So just walk normally the way you walk towards me, and then turn and face that way, same thing. And good, one more time, towards me, and then away. Perfect. Now I'm going to stand from the side, and I'm going to watch you do the same thing. So walk that way. Good, and come back. Good, one more time. And again. Okay, good. So next we're going to look at your posture. So for this, I'm just going to get you to face me, and I'm also going to landmark with my hands a bit to see how you naturally want to shift and stuff. So just stand how you normally would stand. And then as I'm doing this, I'm checking for tension in the body, if there's any swelling, heat, looking for like varicose veins, swelling, all that kind of stuff. Turn and face this way. And then same thing, just going to check your shoulder position. We know that this is the one that's bugging you, so I'll make sure to be nice and gentle, paying attention for any swelling, heat, that kind of stuff. Good, turn and face away from me. And good, and then face away. Okay, so then from here, what I'm going to get you to do is I'm going to get you to reach forward as if you're going to touch your toes. Good, and then come back up. Perfect. Now I'm going to get you to balance on your left foot and bring your right leg up to about hip height. Perfect, come back down. And again, same thing, other side. Perfect. Good, awesome. You can have a seat on the table. I'm just going to move back a little for 1 second. Perfect, you can have a seat. Okay, so I'm going to get you to do that same thing where you kind of reach forward between the legs. Good, perfect, come back up. Then make sure you cross your hands across your chest. You're going to be nice and relaxed. I'm just going to rotate you. Good. Perfect. I'm going to side bend you to the side. Good, perfect. Then I'm going to get you to put your hands by your side, and you're going to reach your arms up nice and careful with this right shoulder. If there's any pain or pinching or anything, just stop at that range. And you're going to try and bring that arm up above your head and get the back of your hands to touch each other above your head as best as you can. Whenever you're ready. Good, and then come back down. Then I'm going to see from the front again, same thing. And good, perfect. Now I'm going to get you to do your neck range of motion, so looking up and looking down. Good, and then head at neutral. You're just going to rotate from one side to the other. Good, and then back to neutral, ear to one side and then ear to the other side. Good, perfect. I'm going to get you to lay on your back next. So what I'm going to be doing here is just seeing how your ribs move when you breathe. So just breathe like you normally would. I'm going to put my hands at the bottom of your ribs, then mid ribs at the side of the chest, and then above the chest. So take a nice big deep breaths, breathing like you normally do. And this again just gives us an idea of any restrictions that you may have elsewhere in the body. Good, I'm going to go to the sides now, same thing. And we're also noting to see if there's any like difference from side to side. Good, and I'm going to do top, same thing. Good, perfect. Next, I'm just going to check movement in your legs. So nice and relaxed, let me do all the work. just always let me know if there's any pain at all. Good, perfect. I'm gonna put one leg on your knee, and then just let that come out, relax to the side. And good, perfect. And then same thing, other side. Okay, good. And again, we're looking for differences in restrictions. Okay, then what I'm gonna get you to do next is I'm going to get you to stand up onto the ground there. We're just gonna do a couple more things here. I'm gonna get you to side bend to one side. Good, and then other side, same thing. Good, and then I'm gonna get you to sit down as low as you can, keeping your heels on the ground. And good, perfect. So I'm gonna get you to lay down with your head on this side on your back, and we're going to go over some of your shoulder stuff here, since that's the area that you've been struggling with. So I'm just gonna do passive ranges. If anything hurts, just let me know. I'm gonna go really light and carefully, and we're just gonna see kind of where your ranges are. We're just gonna be very mindful of this joint. So stay nice and relaxed. And good. And good. So upon the examination, we're finding there's still some swelling in the right shoulder, so it's probably an acute like strain or sprain of the muscle, kind of like when you pull a muscle, which is what happens sometimes at the gym if we push too hard or we're not in the right position. So what we're going to do for our treatment today is we're going to do really light myofascial work, so that's going to help open the joint up a little bit, allow some more fluid to get in there and to heal, and if there's any swelling, it'll help that fluid get out, so it'll heal quicker. We're also going to do some joint play to try and get a little bit of motion in that joint to kind of teach your body that it's safe, get some more fluid in there to help with the healing process. We're going to utilize something that's called BLT. So basically what we do with that is we move the joint a little bit, we go out towards the direction where it was when it was hurt, we wait until we kind of feel like there's a wobble, which kind of helps get all the ligaments back to where they're supposed to be and kind of balance, and then we are able to put it back in neutral and it's more likely to stay there. And then we're going to finish up with just a little bit of lymph drainage in that area to help the fluid get out of there. Treatment is going to be about once a week for the next 5 weeks. After that, we'll kind of reassess and see where you are in terms of pain, mobility, and strength. But what we want to do is relieve any of the restrictions. In the further on treatments, we're going to add some things like muscle energy technique, which is where you use active motion to try and almost counteract my stretch, to allow that muscle to open up a little bit more so that we can get more movement in there, deal with the scar tissue as well if there is any that occurred from this injury. And then we're going to work on balancing out the muscle on the front and the back, because typically what happens when we have injuries to the front of the pec, anterior delt area, and your bicep tendon is that everything curls forward. So we need to open this up and make sure the back of the shoulder is nice and strong to keep everything where it's supposed to be. So we're going to start with our myofascial stuff first. And again, if anything is bugging you or hurting too much, just let me know. We're going to do super light work. We're not going to use your arm as a lever or anything. We're just going to keep your arm in the most comfortable position for you throughout all these treatments. So with this, we're just opening up the fascia, trying to get that area to relax a bit because it's going to be nice and tight, trying to protect that injured area. So we want to try and do light work to relax the nervous system to get into those muscles a little bit better. And for fascial techniques for this one, I would focus mostly on pec minor, pec major, our anterior delt, and our biceps tendon a little bit. And with this, what we're doing is we're just using light pressure, we're engaging the tissue, and then just going until we feel a release. And there shouldn't be any pain with this. And I'm stacking the tissues into ease just to kind of do an indirect method so that it's less intense on the tissue since we are dealing with that injury. perfect. Now things are loosening up in here. We're just gonna play with the joint a bit. So just stay nice and relaxed. What I'm gonna do is stabilize the top of the joint, which is our scapula or your shoulder blade. And then I'm gonna be moving the humerus inside the joint. So the upper arm, that bone kind of in that ball and socket joint. And we're just gonna focus on doing really light, small movements in a couple different directions just to try and ease that in, since we still are in that acute phase where injury is still pretty fresh. As we go through the healing process, we'll be able to increase bigger ranges of motion through this. I'd like to utilize something we call Spencer technique as well to help you get bigger ranges of motion, but we gotta wait till there's less pain and the healing process is further along. Now we're just going to move the joint slightly into the direction that it's loosened up a bit, into the direction where it was initially hurt, so rolling that shoulder forward a little bit. You're just going to stay nice and relaxed, and then we're just going to stay here until we feel the ligaments and the muscles kind of relax around it, and then balance back to neutral so we can bring you back to where it's supposed to be. It's just a way of tricking our body. Good, perfect. Good, and now we're just going to try and stimulate some lymph flow to that area. Is compress the terminal where all the lymph kind of goes to in this area. And we're just going to hold for a little bit just to help stimulate that drainage to that area to kind of help with the swelling. After treatment, if you're feeling sore, you can try adding some heat. If you're finding it swollen, you can kind of do the same thing, just super light touch to the area to kind of push it towards the armpit. If it's swollen, you can add ice or cooled. And then if it's just sore, then you just add heat instead. And you want to just be careful not to, like, since we're opening up the joint a bit, there's going to be a little bit more range of motion. You want to make sure not to stretch that range of motion too much, as you don't want to re-injure it again. So we want to just be mindful of all the new ranges. It'll take time to strengthen up those ranges and kind of reteach your body the proper biomechanics again. But we'll get there further down the road. I want to make sure you avoid like direct stretching of the area until at least the next time I see you next week, just because you don't want to strain the tissues too much. And good, perfect. How does that feel? Good, perfect. This was the video submission for Stephanie Fusnick on